Hi, I'm Dr. Micheal Forman of Forman Dental Care. I'd like to talk about crowns and some of the common questions my patients ask when we're discussing crowns. Crowns are one of the more common dental procedures, second only to that of fillings. Some of the common questions I hear when we're talking about crowns include, why do I need it? Will it hurt? Do I need a root canal? Is there an alternative? And how much will it cost? So let's talk about why a crown is generally recommended. They're recommended when a tooth can no longer support the biting pressure being placed on it and it's beginning to crumble. Often there's a large restoration within the tooth and the tooth material around the filling is beginning to crack and break and can really just no longer support the bite. So the tooth needs something stronger to protect it, and that's what the crown is. The procedure is very simple and comparable to that of a filling. The tooth is shaped and an old filling will be removed if it's necessary. An imprint is taken that will be sent to the lab where the final restoration is made. This takes about 2 weeks, and during that time period a temporary crown will be in place so patients can function normally. Once the permanent crown is ready and back from the lab, it'll be glued in place with a strong cement and patients can function normally. You really don't have to think about you having a crown after it's in place. You can function just as you would on any other tooth. Patients often think that they require a root canal when they're going to have a crown done. This is generally not true and only recommended when a tooth is symptomatic or painful prior to the crown. Otherwise, crowns are done and there's no need for a root canal. As far as alternatives to a crown, the alternative to a crown that's comparable in strength is called an onlay. An onlay is a lab-made restoration that's cemented in place as a unit, but the preparation is comparable to that of a filling and somewhat less than a crown. It does require a significant amount of strong tooth structure to remain successful after it's in place, so it's important for an onlay that early diagnosis and decision to proceed with treatment occurs. Otherwise, it may end up being necessary to do a crown. The last question that patients ask is, how much will it cost? The cost of a crown is between $1,000 and $1,300, depending on the exact nature of the treatment. I encourage my patients to think about their overall health when they're considering any dental restoration, including a crown. All the teeth support one another, and when we recommend restoring a tooth, we're doing it so that you can restore your whole mouth and keep everything healthy and happy, so that throughout your life, you don't have to think about what you eat and you don't have to think about what your teeth are doing, and you can live freely and not have to worry. If you think you may have trouble with the tooth, or if you think you may need a crown, come and see us at Forman Dental Care and see how we can help you.
Dr. Forman and his team are excited to help you build or maintain your smile. If you would like to see how they can help you, please contact them today at 905-303-9355 or visit their website at formandental.com.